Okay, good morning and welcome everyone. Uh, Thank you for joining us this morning. This is the second of three more to come presentations and town halls about the transition to Cigna. Today we will be focusing on navigating the transition. And I will go ahead and introduce the panelists that will be sharing today. We have Hillary Baca from Cigna, Brandon Canfield, and Liz Spano from Cigna. We also have Tiffany Vermillion and Michelle Moreau from Gallagher. Today, I'll be your host. I'm Jaron Lowe, the Interim Vice Chancellor for Human Resources. And without further ado, let's go ahead and turn it over to Hillary.
Wonderful. Thanks, Jaron. So I'm excited to be with you all again today. And as we mentioned on Tuesday, today we're going to get into some specifics on tips for transitioning from Kaiser to Cigna. So our agenda today, we'll talk a little bit about what makes Cigna different. I think it's important to kind of set that stage so you all know how accessing care is going to be different, how the network's different, et cetera. We'll go over the local plus coverage map across the country, just so you get a good sense of, where those local plus markets are, and then what your broader access will be based on the away from home care feature. We'll talk about tips for the transition prior to July 1st. So that is, what can you do now to prepare for this transition between now and July 1st? What are some tips around that? And then we'll also talk about what you can do after July 1st. We'll talk about some options for care. So we have many options for care as Cigna members, outside of just seeing your PCP or specialist, such as virtual care, et cetera. So we'll touch on those. We'll give you some tips to help you save money as you come on the plan. And definitely, throughout all the webinars that we'll be doing, the town halls, I will continue to share some of these tips to save money. I will demo the tools that you will have access to after July 1st as well. So just know that that's coming too. And then today I'm going to spend a little bit of time doing a quick live demo of Cigna.com. So a couple days ago, I mentioned that right now you can hop onto Cigna.com and you can look for providers if you'd like to. So you can sort of start shopping for providers, look to see what facilities are in network, pharmacies in network. So I'll just kind of show you how to navigate that as a reminder. And then we'll open it up for questions at the end. All right, so first, what makes Cigna different? So Cigna is an open market model. And really what that means is that your options for care are not going to be contained within one health system or one provider group. So right now, the way you access care is that, you go to Kaiser doctors and Kaiser facilities. With Cigna, you are going to have much more expanded access. So you will be working within many different hospital systems and provider groups. You'll have the option to see providers or go to a hospital within the Centura system, UC Health, Children's Hospital. Those are some examples. So you will have a lot more options for care. So you will also be able to shop for care. So not only for place of care options, but you'll be able to shop for the difference in price. So this is a big difference from what you're experiencing, right? So you'll have the ability now to go in and let's say your doctor tells you that you need to have an MRI done. You can now use the tools available to you on mycigna.com, or you can give us a call and we can really help you figure out what your options are, whether that's a freestanding facility or if it's a hospital, and what the difference in cost is going to be so that you can make the best decisions for yourself and your healthcare dollar, okay? As a reminder, our Local Plus network gives you access to over 4,000 primary care providers in Colorado. You are not required to have a PCP as part of this plan. So we certainly recommend it. We think it's a great idea to have a PCP as sort of the quarterback of your care, and that person can really help coordinate your care across the spectrum. However, it's not required. You also don't need to see a PCP first to get a referral for a specialist. you will have immediate access to over 14,000 specialists under Local Plus. So what that means is that if the first visit you want to make after July 1st is to your dermatologist, you are more than welcome to find a dermatologist within the Local Plus network and go and see that person right away. You don't already have to have a PCP relationship in place or visit that PCP first, okay? In addition, you'll have access to over 7,000 mental health providers and some of those other virtual providers that I touched on during the Tuesday meeting. So virtual care through MD Live is available, and we partner with vendors such as Talkspace, Maru Health, and Sondermind. You will have access to 60 hospitals within the state of Colorado, and some examples of those are UC Health, Children's Hospital, Centura Health, National Jewish Health, SCL Health, and Health One. Some examples within those systems, Centura Health operates Castle Rock Adventist, Parker Adventist, Health One, Skyridge Hospital, Rose Hospital. So there are definitely a lot of expanded options for you when it comes to hospital systems. And then again, if you're away from home on vacation, you have a child off at college, you have options for away from home care. You can look for a Local Plus provider within that area. And if one is not available, you are actually able to see a provider in our broader open access network in that case. And you have national and network coverage for emergency care. And then in addition to all that, you will have access to thousands of retail pharmacies throughout the area. So that could be your small local pharmacies. It could also be larger retail pharmacies such as King Soopers, Safeway, CVS, Walgreens, Walmart, Costco. Those are just to name a few, and I'll show you how to find those on Cigna.com in a little bit. So I thought it would be a good idea to show you a map of the Local Plus market so you can get an idea what your coverage looks like. So everything in orange is a current Cigna Local Plus market. So what that means is that if we're in the Colorado area here and we've got a lot of Local Plus coverage within Colorado, but let's say you travel to Chicago or you have a child that's going to college in Chicago, there is a Local Plus network in the Chicago area as well. And you can piggyback on that. You can see a provider within that Local Plus network if you visit Chicago. But let's say you go on vacation to Montana. So the areas shaded in blue, that's the away from home care access I was talking about. So if you travel to Montana, for example, and there's not a Local Plus network there, but you will still be able to find providers using the away from home care feature if you need care. And all you have to do is call the number on the back of your ID card, and we're happy to help you find someone in that area that's in network. Or you can utilize mycigna.com to find that information. So just be comfortable and know that if you are outside of the Local Plus coverage area, you will still be able to find care at in-network levels. In addition, I think it's helpful to point out that if you currently live in an area that's not in the Local Plus service area, you will actually be enrolling in what's called our Open Access Plus network. That's that broader nationwide network. So we'll provide more information about those choices soon and how to access those. Okay. All right, so let's talk a little bit about what you can do to prepare for this transition. This is, as I said before, we know this is an important transition. We know this is a big change for folks. So we really, through our experience in transitioning groups specifically from Kaiser over to Cigna, we've come up with some really great tips and tricks for you to prepare to come onto a Cigna plan. So let's talk first about what you should do before July 1st, so before your plan is effective with Cigna. So prescriptions are probably on everyone's mind, right? If you take maintenance medications or any kind of prescriptions, you're thinking to yourself right now, what do I do? Am I going to need to see a Cigna provider starting on July 1st right away? Am I going to need to be in a hurry for that? So really the best thing that you can do in that regard is communicate with your Kaiser physician. So it's a really good idea right before July 1st to get as much of your prescription as you can. So go to your Kaiser pharmacy and if possible, get a 69 to 90 day fill on your current prescriptions from Kaiser. And that way you'll have 60 to 90 days or however long that takes you through into the plan year to make an appointment with your new Cigna provider and get your prescriptions updated. So it will allow you somewhat of a buffer. So I definitely recommend that you try to get as much of your medication as you can before the end of June. In addition, if you're meeting with your doctor, definitely tell your Kaiser doctor that you are moving on to a Cigna plan as of July 1st. And ask if they can reissue a prescription for you. So if they can give you a copy of your prescription, then you will also have enough supply to last you into the new plan year, right? So you can take that prescription and get it filled at a Cigna pharmacy. So these two things will really allow you a little bit of a buffer zone and to make that appointment with your new provider. Definitely get familiar with the pharmacies that are in our network, and then fill accordingly, right? So another thing that you can do now that I've mentioned before is go on to Cigna.com and start shopping for providers. So it's a really good idea as you're looking at those different providers. And again, you can search for providers based on your home zip code, your work zip code, wherever you would like to see a provider in the area, right? So make a list of maybe 5 or 6 providers. Make sort of a short list. So for example, if you're searching for a PCP, look at the reviews, look at the information for those providers, and make a short list so that you have a backup plan just in case. As you start seeing these providers and calling these providers, you may decide you want to go with somebody else. And you are more than welcome to switch providers at any time. You do not have to stay with a PCP if you choose one. And again, a PCP is not required as part of the plan. Okay. The next thing you can do is start thinking about whether or not you should apply for transition of care. So on Tuesday, I briefly touched on what transition of care is, and it's really meant for folks that are under a current course of treatment, or you have an upcoming surgery, right after the first part of the year. Those are really good fits for applying for transition of care. And what that will allow you to do is continue to receive services through your Kaiser provider for a defined period of time. So for example, if you're in your 3rd trimester of pregnancy and you're about to deliver right around July 1st, that would be a great example of applying for transition of care. And we can get you through that process at the in-network benefit level with Cigna. So there is definitely more to come on transition of care, but it's a good idea to start thinking about whether or not you would qualify for transition of care and whether you'd like to apply. We will talk about this in depth at our May 10th town hall. We'll introduce you to our client service executive, Layla, and she will be helping with this process. She will be your single point of contact for any questions that you have and the transition of care application. And we'll get all your questions answered. So certainly attend the May 10th town hall if you think this might be a good fit for you. Your Kaiser provider is really going to help you fill out the majority of the information that Cigna is going to need to know about your current course of care. And then we'll help you with one-on-one support. So just know that you're not alone in this process. We will definitely help you through it. Okay. Some other things you can do, I keep touching on this, but it's important to talk to your current Kaiser provider about your PCP, about the move, and about the fact that you are transitioning to Cigna July 1st. And some key questions that you can start asking your provider are, based on my health status, what are some of the things that I should share with my new Cigna provider? Should I apply for transition of care? So, they can really help you determine whether or not that might be a good fit. And then, am I taking any medications that require a prior authorization, or is there anything that you can tell me that I need to know about my current medications that will help me as I transition to Cigna? Next thing, call Kaiser or go online to transfer your medical records. So this process, could possibly take several weeks. So it's always a good idea to kind of start thinking about this right now. Kaiser should be able to transfer your records to you electronically, or they can transfer them to your new Cigna provider after July 1st. So again, because Cigna is a different model from Kaiser, you would need to send your records to your new Cigna provider versus to Cigna directly, okay? And then finally, starting on April 24th, we briefly touched on this on Tuesday, but you will have a pre-enrollment line available to you starting April 24th, and you can call that pre-enrollment line anytime, 24/7, 365, prior to July 1st to ask questions about your plan options for this coming year. You can also ask them questions about prescriptions, about pharmacies. They can help you find a provider. So if you'd rather not go on to Cigna.com and navigate that yourself, they are happy to help you with those questions and really any other questions you have about transitioning to Cigna. Our personal advocates are really great, and they will be ready to take your calls on April 24th. Okay. All right, so after July 1st, what are some of the things that you can do? You can book a new patient appointment with your new Cigna provider. So, you've spent some time prior to July 1st potentially looking for a new PCP and any specialists that you want to work with. So starting July 1st, start making those appointments with your providers. Get into for your annual preventive physical or your well woman or well child exam. Those are preventive services that are covered under the plan at 100% as long as you go in network. So definitely we encourage you to utilize your benefits under the plan. If you need a new prescription, make sure if for some reason you're not able to get an extended prescription from your Kaiser provider or get a fill for a long amount of time, make sure you get in to see a new Cigna provider pretty quick so that they can help you get a new prescription filled. And make sure that when you're calling to make that appointment that you let them know about that. So if you run into that sort of situation, when you call that provider's office to make your first appointment, tell them, hey, I'm about to run out of my prescription or I need a refill, and they should be able to get you in pretty quickly, okay? Order your home delivery prescriptions. So if you're on maintenance medications, after July 1st, you can just give us a call the number on the back of your ID card. And what's great is that we can assist you in this process. So if you would like to have those medications delivered via our home delivery pharmacy, you just call Cigna, give them the prescription information, and we can take care of the rest. We can work on transferring that current prescription over to Cigna for you for home delivery, okay? And then finally, and I think one of the most important things that I can tell you today is that after July 1st, make sure you go and register on mycigna.com and download the MyCigna mobile app if you have a smartphone. This is going to really be the hub of all the information you're going to need for the plan. You can call us at any time, 24/7, 365, so that's always an option. However, these tools are so helpful when managing your healthcare costs, finding providers. You can track your deductibles to track your out-of-pocket expenses for certain procedures. You'll be able to view your explanation of benefits on the site. You can get cost estimators for different procedures and prescriptions. I mentioned the MRI as an example earlier, but you can also go on there and view, if you need to get a prescription filled, we have a great tool called the Price of Medication tool, both available on the app and the website. And you can type in the name of the drug that you need, and it will show you a map of different providers or different pharmacies that are available to you within your area. And it will show you what that prescription will cost you to fill at each of those retail pharmacies and via home delivery. So that, again, you can look at your options and determine, hey, I see that my prescription is only going to cost me $15 at Costco, for example, and it would cost $25 at Walgreens. So again, these tools are there to help you manage your plan the most effectively and show you your different options for care and different costs. You can also build your health team on mycigna.com. So when you have made decisions on choosing a PCP or specialist or really any provider within your network or hospital or urgent care center, you can build that health team within mycigna.com so that you have easy access to that provider's information at any time. We have, as I've mentioned before, many different options for care under the Cigna plan. So you certainly have access to primary care providers. As I mentioned earlier, there's over 4,000 primary care providers within the Cigna Local Plus network. You have access to over 14,000 specialists. We have virtual care available with MD Live. So as a reminder, virtual care with MD Live will cover minor medical conditions such as allergies. You could call for pink eye, a urinary tract infection, a stomach ache, cold and flu, things like that. They're happy to help you. They're open 24/7, and you can connect with a board certified physician through MD Live. In addition, they offer behavioral appointments virtually, and they offer virtual wellness screenings. You also have all of those behavioral health resources and providers that we've talked about. Convenience care clinics are another option for you. So convenience care, an example of this would be the clinics inside of stores such as King Soopers, Target, Walgreens. They have little clinics in there, so that's certainly an option for your care as well. And you can find out which of those are covered in network under your plan by going to mycigna.com or giving us a call. Urgent care is an option. So urgent care is a great option if you are not experiencing a life-threatening emergency, but it's an urgent situation and you need to get in to see someone. We have a large network of urgent cares throughout the area. And then, of course, in the case of a true emergency, because this is the most costly place of care, emergency facilities are available. We have, again, a number of hospitals that are available to you in the area. We've got a 24/7 health information line available to you. So you can call one of our nurses 24/7, 365. That's a free service offered to you. And they can answer your questions about symptoms you're experiencing, and they can give recommendations on where you should go for care, or if maybe you should just wait it out at home, and they can give you home remedies. So they definitely saved me the cost of a PCP visit when my daughter had the flu. But they encouraged me to wait it out for a couple of days, monitor her symptoms, and she was better. So they are absolutely wonderful. They will follow up with you after your first call to see if you're doing all right. So definitely utilize that resource. In addition, I mentioned the personal health team on Tuesday. So when you call the number on the back of your ID card, you have instant access to dietitians, clinicians, coaches, nurses. You have a health team behind Cigna that can help you with any need, whether that's a chronic condition, a nurse, anything like that. We've got resources available to you. And then retail pharmacies and home delivery pharmacy are your options for pharmacy. Okay. So let's talk about some tips to help you save money. So I've touched on the fact that with all of these extra options that you're going to have for care and to fill prescriptions, you will have this extra information at your fingertips to price out your options and make the best choice for yourself. So in terms of prescription drugs, I talked about that price and medication tool that's available on mycigna.com and the MyCigna app. You can also call us for this information. And what you can do there is not only price out what your medication that you've been prescribed would cost you, you can look at generic options that might be available. And finally, sometimes we'll give you recommendations for alternative drugs that you might want to talk to your doctor about for that certain condition. And so definitely work with your provider to see if some of those lower cost options might be a good fit for you. In terms of care options, you can use the nearest emergency facility for true emergencies. But again, one reminder we always give to folks is make sure you're only using the emergency room for a life-threatening emergency. Outside of that, you have many, many options for care, such as urgent care, virtual care, those convenience care clinics, and your PCP, okay? Provider and facility choice. So you could definitely use the healthcare professional that's most appropriate for your care, whether that be a PCP or whether that be a certain specialist. We have many in the network. You can use Cigna Virtual Care with MD Live. That is often a less expensive option for you versus going in to see a provider in person. And then using in-network labs. So we partner with LabCorp and Quest, and those are your nationwide in-network partners that will be the most cost efficient. Those can save you money by going to those labs. And then proactive measures, definitely utilize all of our health engagement tools that we are making available to you. So that is calling us, that's mycigna.com, that's the app, and you have all sorts of information at your fingertips to make the right decision. And then utilize your preventive care benefit. So I will be providing a robust list of preventive services, right? So these are the services that are covered in network at 100%. So examples of that are getting your annual physical with your provider, getting your well woman exam, that can be with your PCP or that could be with an OBGYN, getting things like your flu shot. So there are many, many services that fall under that preventive umbrella that we would love for you to utilize, because the earlier that you can catch issues by going in for your preventive visits, it could save you money and definitely get you the help you need for your health early on. And you can catch things that could be a problem later. Okay. All right, so I'm going to take just a brief pause here, and I'm going to go to Cigna.com and do a quick demo for everyone. So one moment.
Hi, Hillary.
Yeah.
Here's a there's been a lot of question in the chat, and I think there's a great kind of opportunity really quick to answer this, but a clarification around the high deductible plan and copays. There was a question around what folks currently pay, and will that be matched or the same when they move to Cigna? So it's correct to say that the plans will mirror whatever plan you're on with Kaiser and you move to Cigna. Those will mirror each other in terms of copay. Correct?
Right, Brandon, can you confirm that? I think that is the case. Yes.
Hey, Jerron, it's Brandon. Yeah. So we did mirror the copays and offered everything as close as possible, Kaiser's including. So PCP copays, specialists, urgent care, all those things would match.
Perfect. All right, thank you.
All right. Great. Fantastic. Any other questions that we want to touch on before we get to the demo of Cigna.com? Okay, great. So just want to verify that everyone can see the website here. Great. Okay, so I've mentioned Cigna.com many times to all of you as a tool that is available to you prior to the plan start date. So this will be available to you prior to July 1st. And it's really easy to search for providers within the Local Plus network by using Cigna.com. Okay, so all you do up at the top of the screen here, you're going to click on Find a Doctor, Dentist, or Facility. On the next page, it's going to ask, how are you covered? And you're going to click the button that says Employer or School. And then you can type in your address, your zip code. Again, you know, maybe you like to see a provider close to home. Maybe you like to see a provider close to your office. You can put in whatever information you would like in this case. So I'm just going to choose the Denver zip code, 80222. Okay, and then once you put in the zip code, you will have the ability to choose whether or not you want to search for a doctor by type, by name. So a good example is you can search for a doctor by name. Let's say you were on a Cigna plan a few years ago, you had a really great provider, and you want to see if that provider is still in network. You can go and search for that particular doctor by name there, or maybe you have a recommendation. You can type in the provider's name in that area. But I am going to show you an example of doctor by type. So it will give you a menu of different options here, but you can also just type in primary care, okay? And it will populate the list for you. So within primary care, you could look for a PCP, a pediatrician, family practice, etc. So we're just gonna search for a PCP here. And then when you get to the next screen, of course, prior to July 1st, you won't have a mycigna.com account, so you don't need to log in. That's not necessary. You're just going to continue as a guest for now. Okay. And then it's going to ask you to please select a plan, and you're going to continue. And then here's where you're going to indicate that you will be on a Local Plus plan. So right in the middle of this list here, you'll find Local Plus, and you're going to click on that. And now it's going to populate a list of providers that fall within your search criteria. So again, you searched for providers available around Denver 80222. Your medical plan is Local Plus. And then it will provide a list. In this case, it's given us a list of 245 in-network PCPs just within that area, right? So as you can see here, it will show you the name of the provider, the affiliation they have with a clinic. So this particular individual, Jeremy Erdley, is actually affiliated with Southeast Denver Pediatrics. Shows you his address here, phone number, specialties, if applicable. So the first few folks that showed up on this list are showing as pediatric specialty. It'll also show you the hospitals they're affiliated with as well, so you can see that information. How many years they've been in practice, if they have a Cigna Care designation, and what that means, that is a special designation that we give to providers, and we're gonna always push those to the top of the search list. So those are providers that, based on a rating system that we have, we feel are highest in quality and cost efficiency metrics. So that's why we always like to introduce you to those providers first at the top of the list here. And then you can click on additional quality ratings. You can view information such as patient reviews to really get a really good idea of whether or not that provider would be a good fit. You can also see information such as, do they speak any other languages? So if you would rather see a provider that speaks Spanish, for example, you can find out if that provider speaks Spanish by clicking on their information. And then of course, over here on the right-hand side, you can see accepting new patients. So this particular provider, based on the information that they transmit to Cigna, is telling us they are accepting new patients. But again, it's always a good idea as you're doing these searches to make a short list of maybe 5 or 6 providers that you want to call, just in case maybe the day before they reached capacity or something. So this is a good tool to help you start shopping for providers, but definitely give them a call, ask more questions, ask information about their practice. This is your opportunity to find a provider that's a good fit for you. Okay. And I'm just gonna scroll down here. You click on the provider, this is where you'll be able to see that extended information. So for some folks, they've given us their pictures, so you'll be able to see that information. You can see that this particular doctor is board certified in pediatrics. You can see more information about their hospital affiliations, view their education, confirm they are in network and accepting new plans. And these are the different Cigna plans that they are in network for. So hopefully that is helpful. And then I'm going to go back over here for just a second, and we're instead going to search for facilities. So if you go over to the health facilities, this is where you can see which facilities are in the Cigna Local Plus network. So that could be a hospital, it could be an urgent care, lab testing. You can search for information on behavioral facilities, physical therapy. And then finally, pharmacies. So this is where you would go to find the pharmacies in your area. So I'm going to click on that. And again, based on my original search result of 80222 and the fact that I am on Local Plus, it's giving me all sorts of pharmacies that are in my immediate area. Lots of options. So I've got 51 just in this area. So Welsher Pharmacy is one of them. So that's a local pharmacy that's available to you. In addition to King Soopers, Walgreens, see Safeway here, another local pharmacy, CVS, Centura Health. As you can see, lots of different options for pharmacies. And there's 3 pages that are populating here. And you can see where they fall on the map over here with their information if you hover over. Okay. All right. And then the only thing I wanted to do in terms of pharmacy, expanding on that, is that you are able to view, I believe the drug list has been posted on the DU healthcare transition page. So you can view the drugs that are available within your formulary that are approved drugs under the plan. But keep in mind, if you're not seeing a drug that's on that list, that's one of the things that you can call the Cigna pre-enrollment line about on the 24th. You know, definitely if you have additional questions about what's covered, please give us a call. You know, that it's a pretty comprehensive list, but you know, you may find that you're on a drug that you're just not seeing on there, and please reach out to us with questions. All right. So with that, I'm going to stop sharing, and Jaron, do you want to say anything before we open it up for questions?
Absolutely. Thank you for running through the transition. And we have a few questions in the chat that we want to get to, and many have been answered on the back end. But let's go ahead and open that up right now.
Okay, so we have several questions again that I think were answered, but some that I feel like I caused some confusion on. So let's start with this. And Michelle, I'm going to ask you to address this question. And if you'd like me to, since I'm the one that caused the issue, I'm happy to. But keeping with our format here, Michelle, can you explain to everyone the difference between Local Plus, the HMO, and the HDHP plan? I think there's some confusion that these are three different things rather than the plan options underneath the Local Plus umbrella. So I'm going to ask if you can try to clarify that for everyone.
Well, I believe the major difference is it's not in the network. It's not in the group of providers that you see. It is actually in the plan of benefits. So the HMO plan has that more lower out-of-pocket cost to the member, whereas the high deductible plan has a lower premium amount, but an upfront higher cost in satisfying the deductible first. So before any benefits are paid on the high deductible plan, you must satisfy that deductible, except for preventive care, which is covered at 100% on the onset prior to any deductible being served. So it's not really about the network. The network is the same network for both of those plans, unless you're out of area. And if you're out of area, then you get that broader network. But it really comes down to the benefit levels. So it's either that more first dollar coverage under the HMO at a little bit higher premium level on a month-to-month basis, or a lower month-to-month basis premium with higher upfront costs in satisfying that higher deductible initially. Tiffany, is there anything you'd like to add?
I think you've answered it, Michelle. And just to say this one more time, both of those plans sit on the Local Plus network. So during open enrollment in May, you will choose, and I should point out that's going to be May 10th to May 28th. But during open enrollment, you will make a selection between the HMO plan or the HDHP plan. But both of those plans utilize the Local Plus network. So hopefully that clears it up, and I will keep watching the Q&A to ensure that it does, or if we've left you more confused again. Layla or Hillary, can you speak to how an employee at DU might be able to find a review for a provider?
I can speak to that. You bet. So what I just showed you on Cigna.com, you can click in when you do the search for a provider. You can see the reviews for that provider, or when you're on the plan, you can go on to mycigna.com and you will see some expanded information on those providers as well. So we have put information out there on providers that we have reviews on. So, you know, I was on there the other day looking for a provider, and I saw several. One provider I was looking at had about 10 different reviews on mycigna.com. So we have made those available to you if there are, in fact, reviews.
Okay, great, thank you. If there are not reviews, do you have a recommendation for a good website where an individual could go outside of Cigna? Oh gosh, well, like ratemydoc.com.
Yeah. Yep. The first thing that comes to mind is some of the larger health systems with providers have reviews on those providers as well. I also know that there's Google reviews, but you kind of have to be careful about those because sometimes they're not the most accurate. Can you think of anything else, Layla or Brandon? Any other good sites outside of ours that would have reviews for providers?
Apologize, I was on mute there. I typically use mycigna.com for the reviews that I personally use, or a cost and quality metrics. So on top of the reviews that'll be there, there'll be cost and quality metrics based off 3 stars that are included for physicians on mycigna.com. So for example, my primary care physician is a 3-star cost and quality reviewed primary care physician who has good reviews. I just personally use that website. I know some folks will Google and do things like that, but I like to use mycigna.com, and that'll be available to you after July 1st.
Thank you, Brandon. Layla, maybe you can answer this for us, and if not, maybe Hillary can. There's a comment that someone tried to reach out to a provider from the info on the website, on the Cigna.com's website, and the information was not correct. So can you speak to where that information comes from and how often it might be updated?
Well, we depend on the providers if say they change their phone number, change location, whatever, to update their contracts with us. So if they've recently changed their number or changed locations, they have to give us that information. But sometimes when the phone number doesn't work, I typically will Google, like we just said, to look and see if we can find the new location. But the information is updated. I believe they said every 2 weeks on the website for providers. And that's why I always say check the website to make sure that someone's still in network, that kind of thing.
Yep, and to piggyback off that, so it's actually every 15 days, not to get overly precise, but it's every 15 days we update the website. And we have a team internally at Cigna that manages our relationships with providers, and they're constantly reminding providers, if you make changes to your office, your phone number, anything like that, please reach out to us so we can update that website. They're in constant communication to make sure there aren't any errors, but once in a while, a provider will forget to send us the information, and we'll have to reach out and remind them.
Thank you. Hillary, I know that we talked about this on the last town hall, but I'm guessing not everyone has had a chance to have seen the recording yet. Can you talk a little bit about transition of care, specifically in regards to chronic conditions such as rheumatoid diseases, MS, biologic infusions, infertility, that is currently being treated outside of the Cigna network? What is that process like for those individuals?
Yeah, I mean, Layla and Brandon, I think I'll ask you to interject as well. But the first thing I'll say about that is, transition of care is a really good fit for folks that are currently under a course of care. So you have a surgery coming up, you're under, you're in your recovery period of a surgery, you're in 2nd or 3rd trimester of pregnancy, you're under chemotherapy, something like that. So there's a very wide range of conditions that might qualify. And if you ever have a question about specifically your own situation and whether or not that might qualify, certainly reach out to us. Layla, who is on the phone, who just spoke a second ago, she is going to be our resource specifically for transition of care, and she can help answer those questions. And we will be going over a lot more detail on May 10th during our town hall about that process. We'll go over the application, what we'll need from your provider, time frames, all that good stuff. So Brandon and Layla, do you want to add anything to that?
I can just add that transition of care is designed to make sure that if you're going through a procedure that must be finished with your current provider, and it's not a good idea to move you to a new provider, we want to make sure you finish out your course of treatment with that provider. That's why we've created the process. We've made it as simple as possible, and we'll provide the information for you to fill out and to provide to your physician, who can also fill it out and send it into us, actually send it into Layla, and we'll process it and make sure that you finish out your course of treatment as needed with your current physician.
And if I could add something to that, that transition of care is really a universal process. So it is pretty much identical, the process itself, when you transition, whether it's from Cigna to Kaiser or Kaiser to Anthem or Aetna to whatever, because it is a medical process, and everybody in the health field wants to make sure those go correctly. So the information that you will be providing to Cigna is not just because we're transitioning to a Cigna provider. It's a universal process. So those same elements and information would be requested for any transition. And I think that might be helpful for people to understand. This is pretty universal for transition nationwide.
All right, thank you. Michelle, I'm going to start with you since you are off mute at the moment, and I know you're going to give us a great answer to this question, and then Brandon jump in as well. We have been talking a little bit about where under Cigna can you just go to one facility to get all of your testing done. And on the last town hall, we said there are certain organizations in town that do that. So maybe Centura, Newest Physicians, will keep all of that information or all of those services together. UC Health. Can you talk a little bit more about that? What does that look like? Do we know if they will share access to medical records if we go see a physician at one of those? I don't even know what we would call them, provider groups.
Yes, the Cigna network does have provider groups that operate more in that affiliated manner. And many of them do have electronic records that they can share within their systems. But I think that goes back to the setting yourself up with a new provider. If you reach out to the pre-enrollment line or the One Guide for assistance, if you tell someone on One Guide, your personal health advocate, what you're looking for, I think they can help you find that provider group that it works best for you. So if you say, I'm looking for a group that I can go and get not only my primary care visits, but get my lab work done, maybe some that have imaging services, such as UC Health, I'll just use that as an example. Many of their primary care and specialty offices do include those types of services within it. So I think when you're making your choice, if you'd like assistance with that, that's exactly what the Cigna advocate system is set up to do. So if you can say, I'm looking for this in a medical group, or I'm looking for a medical group that will, if I do need any surgeries or anything of that, that I can use these hospitals. I think the more information you can provide like that, the Cigna advocates, personal health advocates, can help you find those providers, those facilities, those types of offices that will work best for you. But does the Cigna network have some of those? Yes. They also have primary cares and specialists that operate independently. So I think there's enough offerings to help match all of your needs. But I think it's an important process to go through. And I know that Cigna Health Advocate is there to assist you. So Brandon, do you want to speak to that as well?
Yeah, I would say I only use a primary care physician that utilizes that model. So when I see my primary care physician, and again, Cigna helps you pick these primary care physicians through your pre-enrollment line or our online resources, but I'm utilizing somebody that has 3 stars on our cost and quality metrics. Before I visited them, I asked them how they handle service. When I go to see them, I get my annual physical. They have the lab work done right there. They actually do the lab work in the same room that I have my physical. And then I have some pre-existing conditions that run in my family. So there are some additional tests that are covered as part of my preventive visit at no cost to me that are done right there as well. So they do everything in-house. I just made sure to check on Cigna or mycigna.com, their rating. And then before I visited them, when I was making my appointment, I just confirmed what they could do. So a simple process.
I'll add one more point for clarity. I think the major difference will be even the medical offices that will do blood lab work or x-rays, imaging, the things that Brandon just talked about. The major difference will be that most of those medical providers will not have pharmacy prescriptions right there on site. Some may, but I would say that will be the largest difference, where the Kaiser clinics do have those prescription drug services within their clinics.
Yep. And I would say, Michelle, if you don't mind if I just add one other thing to talk about pharmacy. So a good example of that would be, I had to pick up a prescription. I was in my primary care physician's office. I can go to any Walgreens in Denver, and I have one that's designated to me that has a drive-through. I sat in her office, she prescribed a drug to me, submitted the prescription electronically to the Walgreens that was close to me. On my way home, I drove there and picked up the prescription 30 minutes later. So even if there's not a prescription or pharmacy in their office, we've got a national chain of pharmacies, and you will not have an issue finding an in-network pharmacy near you. That's just my pitch on our pharmacy right there.
All right, great, thank you all. Jaron, I think you have kind of raised your hand to answer a question for us, and thank you. So there's been a question posed, and this was posed in the last meeting as well, that we keep talking about the monthly premiums will be lower, but the co-pays will be the same as they are today with Kaiser. The out-of-pocket maximums, the deductibles, everything will be the same. Yet at the same time, DU employees are hearing the message that all of the savings achieved by the university will be passed on to the employee. So Jaron, can you speak to that?
Absolutely. So with the annual costs being reduced to the university by 1.2 million, those savings are going to be passed on to the employees, and we'll see that in the premiums. And so anywhere from 22 to 33% reduction annual savings in their premiums will be realized. And we also included in that 1.2 million that's passed on, we will be doing a premium holiday in November, which does not require employees to have to pay that premium cost for the month. So that's where the savings will be seen. And yes, with the co-pays remaining the same across the plans, that's a great question for clarification.
All right, thank you, Jaron.
And actually, just to add one last thing in that percentage. So 22 to 33% will be for those folks with the elimination of the wellness incentive. Those who have been utilizing that could see 22 to 33% of savings, and the others who haven't utilized that wellness incentive could see 13% annual savings on their premiums.
Great, thank you, Jaron. Hillary, circling back to transition of care, do you have any estimate on how many transition of care applications are approved versus denied? What is the likelihood that someone's transition of care will be approved?
Mm-hmm. I mean, obviously every situation is different, right? But with all the clients that I work with, I personally haven't seen many, if any, denials. I mean, Brandon, do you want to add to that at all? It's a pretty seamless process for you, so I don't think you're going to run into situations where we're going to have a lot of denials or anything like that. So you can feel comfort in that, Brandon.
Yeah, I would piggyback off that. I mean, we're going to do everything we can to make the process as easy as possible for you and get your transition of care approved. It's not something that we track from a percentage basis locally, but my experience has been very, very rare that those are denied.
Brandon, we have another question that was specifically pointed at you, so I'm going to keep picking on you here. There was a question in the chat regarding infertility treatment. So someone that is currently undergoing infertility treatment, we have frozen embryos. The specialist that this individual is seeing is not under the Cigna Local Plus network. So we've talked about the potential of trying to get that specialist into Local Plus. If it's not an option, do you think that transition of care may be an option, since it's not easy to necessarily or possible to transfer frozen embryos from one specialist to another?
Yeah, I would say there's a few things that we would like to follow up on this one on, is if we could get the provider's information and we could have our team reach out to that provider and see if we can add them. That would be the first thing. The second thing would be get the information for the transition of care process and start that process rolling. But that's something that I'll take away. And if we can get additional information on that, would like to handle that.
Okay, so I just want to point out that the person that's asking this question is coming in as anonymous. So for you, if you can either reach out directly to Layla, who I believe has provided her contact information in the chat, or you can reach out to shared services. That way we can follow back up with you. Okay, Jaren or Lloyd, I have another question for you. If an individual is currently on the high deductible plan and is participating in wellness, they don't pay any premiums. What does that look like going forward? Since the wellness program is going away, or not the wellness program, but the wellness participation incentive is going away, will this individual now have to pay premiums out of pocket, or will the plan continue to be free for them?
Lloyd, are you able to take this one?
Good morning. The premium models that I have seen so far do show that for that employee-only tier in the high deductible plan, that the rate is $0 per month. Now we're working on finalizing those rates, and we have not put those rates out, but we hope to have a zero cost option under the high deductible plan.
All right, thank you, Lloyd. Liz, I know that you are actually typing an answer to this question as we speak, but I think it's a really good question for everyone to hear, and it's a little bit nuanced. So regarding prescriptions, we had talked about shopping around for the best price for prescriptions, but we also have copays in place for prescriptions. So can you talk about, do individuals really need to shop around, or can we just go wherever we want and pay that copay?
Sure. So I was just typing that on the high deductible plan, you do have a deductible that will apply that you need to meet before your prescription copays set in. So while you're in that deductible period on the high deductible plan, you would really benefit from using that prescription cost tool on mycigna.com to look for the best prices on your prescriptions, because they really will vary from pharmacy to pharmacy. So that is a great tool to use. You can see, what your out-of-pocket costs for the prescriptions will be. You are getting a Cigna discount on those drugs, so you're not paying, a full retail price. You are getting a discount, but the discount will vary from pharmacy to pharmacy. So you can use that tool. And then after you meet your deductible, your copay will, the copays begin on the high deductible plan. And then on your non-high deductible plan, on the regular OAP plan or Local Plus plan, you have deductibles, from the start. So you wouldn't necessarily need to use that tool. You'll have copays right away. Does that make sense?
Great, thank you. It does. And then speaking of prescriptions, Lloyd, I'm not sure if you can answer this for us. Where can individuals currently find a drug formulary? I believe you all have that posted today.
Hi, I sincerely apologize for the delay. I was busy responding to other inquiries. It's my understanding that Marcom has uploaded that to the information site. We will definitely put that in the Q&A if possible, and we'll disseminate that information to the group. Can someone from Marcom confirm that the formulary information has been uploaded? Well, again, we'll get that link to you, and then we'll work with Marcom to make sure that is available.
All right, great. Thank you, Lloyd. Brandon, a question for you. We have a few questions coming in surrounding vision coverage under the plan, but one that I think is really important. Most of these have been answered by now, but what about medical conditions that have to do with the eyes? So for example, macular degeneration, would that be covered under the Cigna plan? Or would that be something that an individual would need to access care through IMED?
I might kick that one over to Layla, just because it's very plan specific. Layla, did you hear the question, and would you be able to respond?
Yep, I'm pulling up my resources. I'm pretty sure that macular degeneration and the treatment of cataracts is covered under the medical, but give me like 5 minutes here to make sure that I don't speak incorrectly.
We'll circle back on that one.
Okay, thank you.
This is Michelle. I would say generally anything that is a medical diagnosis or for the treatment of a medical diagnosis will be covered as a medical condition under the medical plan. And we'll wait for Layla to provide the details on that specific, but if it's a medical condition, it will be covered by the medical plan.
Okay, great. Thank you both. Hillary, and please feel free to direct this if you need to. On our last call, we had a question, and we have the same question again today about LGBTQ plus affirming doctors. How can we find those individuals? We know that there's not necessarily a tag out on the website, and I believe you all were researching this. Have you been able to determine if the Cigna One Guide or the pre-enrollment line can help direct an individual to an affirming doctor?
So I do know that the distinction is not on mycigna.com and cigna.com when searching for a provider, but Brandon, remind me, because I think that you were able to follow up on that piece somewhat.
Yeah,
right?
Yep, absolutely.
Okay.
To your point, that's not information we collect. That's information we typically lean on our provider partners to respond to when you're reaching out to work with them. If it's helpful, we would be happy to reach out to a few provider groups in the Denver area and confirm with them and provide that information to DU as a whole. But standardly, our provider partners would let our members know that.
Okay, so do you know then, Brandon, is there a way for an individual when they're trying to find a new provider, is there anyone at Cigna who can help them with that? If not, I know we're going to have access to health advocacy services, and so Michelle and I can research if they are able to help find appropriate care for these individuals.
Yeah, our pre-enrollment line and our One Guide service should be able to help. I'll follow up on that though. I want to get a definite answer, and we'll just have to take that as a takeaway and get back to you.
Okay, so I know for the individual to ask that question, we do have your contact information, so we will reach back out. But I think I'm gonna just volunteer for everyone that we will get that into the FAQs as well, because I know that question has been posed by several individuals. We also do have confirmation now that the drug formulary is posted out on the Transition to Cigna site. And I can see if I can post this somehow in the Q&As, the link to that site as well. Brandon, anyone really, can we talk a little bit? I know this came up on the call the other day, but I do think it's important. If someone cannot find the drug that they're looking for on the formulary, does that mean the drug is not covered, or what should that individual do?
So I can speak to it, Layla, if you want to. I'll let you take it, but if you can't, I'm happy to talk through it.
Well, if the medication is not listed on the formulary, I would say calling into pre-enrollment line to make sure, and then your provider, some cases, can submit an authorization request for the medication to be covered under the formulary. Under, you know, say you can't take the generic or something similar to that, they can submit the authorization to be covered under the plan due to medical necessity, that kind of thing, and they can submit that request online or via phone. And in some cases, those medications can be covered if it's one that's considered not covered because of it's not listed on the formulary, that kind of thing.
Yeah. So to clarify, typically there would be another alternative that you'd be able to take, whether it's a preferred or generic brand or another medication that we found to be more impactful. But if there's not, there's the appeal process, and your provider would send that into Cigna, and we would evaluate it and cover the medication if it's needed to be covered.
All right, thank you both. One more question surrounding transition of care. Obviously, this is a very important topic for everyone. So this is particularly in regards to pregnancy. I know it was answered if you're in the second or third trimester, then you won't have to change providers. But what if you have recently given birth and you're dealing with still some postpartum issues? Might that be considered for transition of care? And then what about a pediatrician for a newborn? Can that carry forward for a certain amount of time while we're getting through well baby checks? Or will we have to find a new pediatrician right away?
So I would say,
I can, go ahead.
No, you're good.
Brandon, I was just going to say that, in the case of the newborn, eventually you will have to get a pediatrician on the Cigna plan, but if there's a specific medical situation that's going on or a treatment plan that's going on, that's something that you consider applying for transition of care, right? If it's a postpartum situation, yeah, I mean, certainly transition of care covers behavioral items as well. So I think that's a case where certainly reach out to us and consider applying for transition of care. Again, it is for a predetermined amount of time during your course of treatment, whatever that's determined to be. So yes, eventually after that treatment is over, you will have to find new Cigna providers. But yeah, certainly in that case, please reach out to us and consider applying for transition of care. Brandon, go ahead if there's something you wanted.
No, I think you covered it well. Thanks.
Okay, thank you. Circling back on medication, the appeal process specifically for those drugs that are not on the formulary. Layla, can you tell us about how long it takes for the appeal to go through? Is that something that members can start working on now? We have someone that's saying that there are several medications that their family utilizes that are not on the formulary, which again, we can all understand is a great source of concern there. So can you speak about, how difficult is it? How much time does it take? Can we go ahead and start that process now?
So you can't start it quite yet. We need to have eligibility loaded. So you will need to have been enrolled in our system. So we need some type of eligibility on file, and I'm not sure exactly what date that will be loaded, but which I think I want to say the beginning of June. Once eligibility is loaded so that we can recognize you, they would submit the request, and they can submit an urgent request, which takes about 48 hours. A typical request, as long as we're not lacking any information, can take like 3 to 5 days. Usually, if we've got everything we need, it's pretty quick turnaround time, but it can also be submitted as urgent. Say that you were unable to fill that medication just before the transition, we can get that pushed through. Someone from the team could get a hold of me, and I can certainly escalate the request as well.
Okay, thank you, Layla. Lloyd, we have a follow-up question for you on the wellness incentive. So I'm going to read the question to you. Using the wellness incentive, we paid $0. So what is the 22% to 33% savings? This isn't really clear.
The 22 to 33% savings, as I understand it, is the overall savings for the plan. Again, when we look at that wellness incentive, when we would receive the rates from Kaiser, those rates were inflated so that those who did not participate in the wellness incentive program would pay a higher cost. Those who did participate would receive a reduced premium. And so those who weren't participating in the wellness incentive program were helping to fund that program. So when we take all of the costs and all of the reductions, we're looking at a 22 to whatever that percentage in savings there.
All right, thank you, Lloyd. And one last question so far. So again, if anyone has more questions, get them in here. Layla, I'm going to ask you because you have access to the plan documents, and you may need to look this one up for us. Are laser treatments for facial port wine stains or birthmarks, is that covered? Searches online are contradictory, so we'd like to be able to look at the actual plan document to see if that's covered.
I'm looking up the coverage policy right now so that I can answer that. There are certain instances where it is considered medically necessary, which I could share this coverage document. It is available online also, so I could email it to the team. There's just specific instances when it is covering, if it's affecting vital structure, if the lesions result in any ulceration, pain, bleeding, repeated infection, difficulty in swallowing, eating. So there's certain instances, and I can certainly send this over to whomever might need it. If they want to pop back in the chat, I could email it to them to answer that question. And real quick, to circle back to the macular degeneration, it is covered under medical. As Michelle said earlier, anything that is considered refractive in nature would be covered under your vision plan. But if it's a medical condition, I would reiterate that it would be covered under the plan.
All right, thank you, Layla. Okay, well, that does it for the questions that have come in so far. If you have additional questions, please feel free to reach out. Oh, 1 second. Yes, Layla, can you send that document to me, and I will get it over to the correct individuals to get that posted out onto the transition website.
Absolutely.
Okay. All right, well, I think that does it for today then. If there are no other questions, I'm not seeing anything else pop up. Oh, 1 second, I spoke too soon. Will the total out-of-pocket match Kaiser's maximum out-of-pocket? And I'll go ahead and answer that and tell you, yes, it will. All of the deductibles and the out-of-pocket maximums have been set to match what you pay today with Kaiser. One more question, Michelle, I'm gonna throw this one to you. Will we be able to access Kaiser records after coverage ends?
I am checking with Kaiser to see as far as online access, but Kaiser will be able to transfer your records to a new physician. So the answer is yes, you can access your records. How long after June 30th? I'll have to get that date from Kaiser, but I would suggest, that as soon as you determine a new physician, that you request those records be transitioned as soon as possible, so that so that you can access it. Or if you want copies of your medical records, you can request those on your own. I believe Kaiser will ask you to complete a form that allows them to release those medical records either to you, to a new provider, or to both.
And Michelle, is it correct that actually folks can start requesting their medical records now from Kaiser? They don't have to wait until they select a provider, correct?
Yes, that is correct.
Okay, we're getting more questions, so hang tight, everybody. I think these are important to answer. So Michelle, I'm gonna toss this one to you since you're still up on my screen. When talking about savings, I assume we're also talking about for all options, not just for individual plans, but family plans. And actually, Michelle, I probably should have kicked that to Lloyd or Jaron, but I think I'm seeing a lot of heads nodding that yes, the savings will be passed on to all tiers of coverage, not just employee only. Okay.
That's correct.
Michelle, I'm still going to pick on you. Everything is matching Kaiser this year for transition. Will that change next year or in future years?
There is no intent at this time to change the plan designs. The plan designs are usually looked at in recognition of cost increases. So if we have a year where the cost of the plan is increasing to a high level, depending on the university's budget for healthcare programs, their plan alternatives may be looked at in relation to the pricing of the plans. But I would tell you at this time, we have no knowledge of any interest in changing those plan designs at this time. And Jaron, I don't know if you want to add to that or not, but that's my honest answer. I am not aware of any intent to change them, and it usually is in relation to cost adjustment.
Yeah, that's correct. Nothing to add.
Okay, Michelle, this is not in the chat, but while we're giving everyone one last minute to get their chat questions in, since you spoke about plan design changes usually coming because of cost increases, and I know this was a big question we got on the last call, can you speak to, do you think we will see cost increases under Cigna? What's the guarantee that they are not buying the business? And sorry, everyone, it's Cigna that's on the call, but what is the guarantee that Cigna will not come back and ask for a huge increase next year?
Well, that's a great question, and it has come up before. When we look at pricing a healthcare program, it is really based on the experience or the claims that have been charged against the program for services rendered. So if there's a high level of claims or services rendered, and medical costs don't stay the same. So we know each year there could be inflationary costs, because what costs $1 today may not cost $1 tomorrow. It may cost $1.02 or $1.30. So as we price plans, we look at what are the costs under the plan now? Are they running at an equal level? Are they running a little higher? Are they running a little lower? And then there are inflationary costs just for the system itself. And this doesn't matter whether it's a University of Denver or any other organization that has a health plan. So to your question, will there be a cost increase? We use the latest 12-month experience to project what we feel the cost of the program based on actual services rendered and cost of those services. We use those actual dollars to project what we feel it will be in the future year. That is the best and most accurate form of judging what the plan will cost. So we have done that, and when we went out for the proposal, anybody who responded to the proposal, Cigna being one, and the one who won the business, base their premium rates on that actual experience that exists today and projecting it forward. So we evaluate that, and we can tell that they did base them on actual costs. But we also want to ensure that no one is, quote, underpricing that and trying to, quote, buy the business. So one of the things to safeguard that is we say, if you want a long-term relationship, number one, show us how you priced it so we can make sure it's accurate and verify that based on existing experience and moving it forward. And secondly, give us a no more than cap on what you will charge for next year's premium rates. And Cigna was able to do that. So they put a cap of no more than 10% for the second year. Could be less than that. It could be 2%. It could be 5%, but no more than. And that's how we ensure that you can't just give us a good premium rate this year and then charge us whatever you want next year. So we validate it by the actual experience and their pricing of that, but then we somewhat put a guarantee in there of no more than X% in year 2. So that's a really good question, and that's one of the main things that we look for when we receive information from the marketplace.
Okay, with that, I think, Jaren, we are ready to close out. Hillary, I'm not sure if you're able to pull up the town hall slide to speak to the schedule or just let everyone see what else is coming. And Jaren, I will turn it over to you.
Perfect. So I just want to say thank you again for everyone joining, asking such great, important questions. I know if you're thinking it, many others are thinking them as well. And so I'm glad we were able to navigate through those. I want to call everyone's attention to the slide that's up right now and the next 3 town halls that we will be holding. We will have a town hall on May 3rd that's dedicated to prescription transitions. And we will also have another transition of care on May 10th in a town hall around finding a provider and good general tips in doing Q&A around selecting a provider and navigating through that. Many questions have been asked about the recordings. And yes, we are recording all of the town halls, which will be made available on the DU website for transition and with the FAQs. We will have Tuesday's introduction to Cigna that we held 2 days ago. That will be up today on the website, and we're looking at about a 48-hour turnaround from the time of the town hall to get onto the website. So you can review this introduction to Cigna today, and then the others will follow kind of on a 48-hour timeline. So with that, I just want to say, please join us and continue to send in your questions and providing feedback on the website. This allows us to coordinate and categorize the questions that are coming through and make sure that we're responding effectively based on the themes that are coming through and getting that information out ASAP to the community. So I appreciate everyone's engagement today. I thank the panelists for all of the informative information and walking us through in such a thorough, detailed way. And with that, I'll go ahead and close us out. Thank you all and have a great day.